So if you prevent these diseases, you will have helped the health workers, but you have more than enough helped yourself. Because the money, even if government gives you the medicine, it will not give you the money for transport. It will not give you the money for feeding when you go to those health facilities and spend there 1 week or 2 weeks. You have not worked. So if you had prevented this malaria, you would prevent death, you would prevent sickness, but you also keep the money in your pocket. We keep urging people that actually if there is a message that can make Ugandans rich instantly, it is the issue of prevention. Because we know that a big proportion of the money that we earn, we spend it on healthcare for ourselves and the people and our relatives and friends.
Hi everyone, welcome to the inaugural NMS Health Talks Podcast. My name is Sheila Ndwuchire and I'll be your host for this podcast. The purpose of this podcast is to help you understand NMS better, national medical stores, and not really just NMS, but the entire health sector. If you have any questions, please go to our Twitter, go to our TikTok, Instagram, at NMS Uganda. We'll be able to respond and answer all your questions on this podcast. Now, to start us off, I am joined by our General Manager, Mr. Moses Kamabare. Thank you so much for joining us. Now, along the way, you might hear me refer to him as GM. GM stands for General Manager. That's what we call him here. GM, ever since I joined NMS, people call me and say, Sheila, we want something from NDA, and they think I'm in NDA. Sometimes they call me and say, oh, we heard you're working with joint medical stores. Oh, we heard you're working with this and that. There's so much confusion around NMS, JMS, NDA. Perhaps you could start by unpacking for us, how does NMS differ from all these other entities?
Thank you very much, Sheila. NMS, as you've clearly said, is National Medical Stores. It stands for National Medical Stores. NDA stands for National Drug Authority. And JMS stands for Joint Medical Stores. Now, National Medical Stores and National Drug Authority are both government-owned institutions. Joint Medical Store is not. Joint Medical Store is owned, it's an NGO, and it's owned by a group of people who put it together. That is the Protestant Medical Bureau and the Catholic Medical Bureau. They also have the Muslim Medical Bureau and other bureaus under that. So they put together their medical store, and that's why it's referred to as joint. So it was joint between those medical bureaus.
So there's joint and national.
Yes.
Okay.
Now, the National Medical Stores is a government body, a government parastatal. But when you look at the work that we do, it is related to the work of Joint Medical Store. While National Medical Store serves our constituency is government health facilities. Joint Medical Store, their constituency is the health facilities under those faith-based organizations, whether it is Catholics, Medical Bureau, Protestant Medical Bureau, the Muslim Medical Bureau, Adventist Medical Bureau, all of those are served through Joint Medical Stores. National Medical Stores only serves directly the government health facilities. Now, National Drug Authority is also another institution of government, but its mandate is not in the warehousing and the distribution of medicines or drugs, because I will use those two interchangeably, drugs and medicines. National Drug Authority, the mandate is on ensuring that the medicines that you get or the drugs that you get, the drugs that are on the Ugandan market, are of good quality. So, and they are effective. They do what they are supposed to do. And they do that through ensuring that the medicines that come through the ports of entry are tested, are confirmed to be of quality. They also ensure that the places where these medicines or drugs are distributed are licensed. So they license drug shops, they license pharmacies, and also the ones, because it is through those same institutions that even the clinics where National Drug Authority does not license, they also get their supplies through the drug shops and the pharmacies that are licensed by National Drug Authority. So we are related, but each one of us has a different mandate.
Okay, so has NMS been around?
NMS has actually been around. We were born on the same day with the National Drug Authority. So NMS and NDA were born on the same day. One, we are like twins. One was born in the morning, another one was born in the afternoon through the Parliament of Uganda. Those two laws were passed by the Parliament of Uganda in 1993. So that's where we were born. So we've been around for more than 30 years. Actually, this year, NMS and NDA, we are making 31 years.
Wow.
Yes.
And
so
we've
been around.
What exactly does NMS do?
The mandate as given to us, to national medical stores or NMS by the law that was passed by Parliament was in three phases, if you would like, or three-pronged. One was procure or to buy, to make sure that we procure or buy medicines and other health supplies that are of good quality and have them available at NMS. The second one was that we warehouse them or we store them well. And the third was that we distribute them to the health facilities that need them. So we ensure that, yes, we understand the needs of all the government health facilities, and that we do through asking the health facilities against the budget that is given to us by the Parliament. So it starts with Parliament passing a budget. So once Parliament has passed a budget or has given us some indicative figures of what they expect to be available in the subsequent financial year, like now they've passed a budget, and we know the figures, the amount of money or the budget for each and every health facility in the country. So we make this information known to each and every government health facility. And we ask them, out of this budget, what do you want NMS to buy for you and to make ready for you at national medical stores? So they put it in writing. And that is called a procurement plan. It is also covered under the law, under the PPDA. The end user, who is the health facility, gives us their need.
Okay, actually, I wanted to ask you, how do you establish what the hospital needs? Is there a process that you undertake? Or do you just sit here and say, oh, we think, you need Panadol, you need...
It's good you're asking that, because we've been asked the same questions. There are many people, many Ugandans out there at different levels, very high level people and even low level Ugandans who keep thinking that NMS sits here. We dream about what a health facility, general hospital, health center too will need and push because we've had that and we keep hearing it over time. We don't do that. We never do that. We inform you about the amount of money that you have, because whatever we give you must be to the extent of the money that has been made available to you by government. We cannot give you more, and we should therefore also not give you less. So once you know how much money that you have, you tell us through a procurement plan, written down, I want so much of syringes, I want so much of gloves, I want so much of Panadol, I want so much of... You list them down against the amount of money, and you make sure you don't exceed the budget which has been made available to you by Parliament.
So what happens if I want to exceed, or if I exceed for one reason or the other?
If you exceed, we get back to you and tell you that the order that you made to NMS is beyond the amount of money available to you. So we ask you to trim it down and get it back within the budget that you have. But we also, whenever you order less, we again also inform you. We tell you that we have more money than what you are ordering. Can you order more so that the items that are here and are needed by the wananchi down in the health facilities get to them?
Okay, now speaking of getting medicines to the health facilities for the wananchi, how do we ensure that medicines are delivered on time?
We do this through what we call a delivery schedule. We inform all the health facilities before the financial year starts, a new financial year, not a calendar year, because government works through financial years. So, and the financial year starts on the 1st of July. So we inform them about the schedule. We tell them that through the next financial year, this is how NMS plans to deliver these medicines to you. Now, that schedule asks you or informs you about three things. One, it tells you when, therefore, if we must get your medicines to you by that delivery deadline, when are you supposed to have given us your order? Because we do not just get the order and process it today and deliver it to you tomorrow. No, we have that process. As you've heard from the beginning, we serve the entire country.
How many facilities are those in the tent?
Now we have more than 3,600 individual health facilities. Wow. They cover government health facilities on a broad range. They are health facilities which are directly under the Ministry of Health, and those are referral hospitals and institutes. So if you have national referral hospital like Mulago, Kawempe, Kirudu, those are national referral hospitals. Then we have regional referral hospitals, which are also under Ministry of Health. You have them in Arua, you have Moroto, you have them in Kabale, you have them in Mbale. So we also have that category of regional referral hospitals. Now, those are the ones that are directly responsible to the Ministry of Health. The lower facilities are responsible to the Ministry of Local Governments. So the local governments are the ones where the general hospitals, or what used to be called the district hospitals, they are under the Ministry of Local Government. So your general hospital or your district hospital, what you call a district hospital, that one is a direct mandate of the Ministry of Local Government. Then we also have health facilities under the UPDF. All of them get their medicines from here. All the health facilities under Uganda Police Force, all of them get their medicines from here. All the health facilities under Uganda Prison Services, all of them get their medicines from here. So we cover an entire range of the health facilities.
And NMS has the capacity to do that?
We have the capacity to do that, and we have built it over time. We are now comfortable that we can deliver medicines to every government health facility, wherever it is in the country. And I think if NMS does not have that capacity, nobody else has that capacity in Uganda.
What modes of transport do you use to deliver? And how does the fleet look like?
The fleet that we have, if the people have cared to look at it, because our fleet is very peculiar and you can see it from a distance. We have big trucks, big lorries, if you would like, that deliver these medicines. We have trailers. They are bigger trailers that deliver, depending on the volumes that we have. But we also have smaller trucks that deliver these supplies. So we have a capacity of more than 80. Actually, now we are about 85 trucks that of different capacities, depending on what we are delivering, that deliver these medicines to the health facilities. And they are both ambient meaning it is at room temperature. If you put a carton, a box of syringes, gloves, those ones may not need cold temperatures. They don't need to be refrigerated. But we also have medicines and other health supplies that need cold storage and extreme temperature. So our trucks also have that cold storage. We can convert them and power them and make them fridges. And we transfer or transport vaccines. We transport other medicines that need cold chain from national medical stores in Kajansi or in Entebbe, and we deliver them to the farthest part of Uganda.
And how do you reach the island districts? Because I know you've talked about the trucks, but how does Kalangala, Buvuma Island, how do they get their medicine?
Yes, we ferry the trucks. We put them on the ferry up to the headquarters, and once we offload the medicines, then we distribute them from there to the individual health facilities.
Okay, you talked about Kajansi, Entebbe. Where exactly is NMS located? Are you largely in Entebbe now or Kajansi?
We are in both places. From 1993, NMS was headquartered in Entebbe, and up until 2022. So it is in 2022 that Kajansi, where we are now, NMS Kajansi, became the headquarters of National Medical Stores. So we still retain Entebbe as our warehouse. We process orders from there for the lower health facilities, but the bigger volumes and also the volumes that come from our partners, our development partners like Global Fund, USAID, UNICEF, we process all their orders from here, from the headquarters. So we are operating both warehouses.
Okay. And what's the size of Kajansi? What impact did it have, or is it going to have on your operations?
Kajansi was inaugurated in 2022. It is a bigger facility. It is a more modern facility for both the ambient storage and the cold storage. And if you'd like, in terms of pallet positions is the way medicines are stored. They are stored in terms of pallets. So we call those pallet locations where the medicines are. Entebbe used to have a capacity of 8,000 pallet locations. Kajansi now has 30,000 pallet locations. So it is almost 4 times as big as Entebbe. Now, Entebbe combined with Kajansi, now we have 5 times as big the capacity that we used to have before. So we are in a better position to serve Ugandans. Uganda is a landlocked country. So sometimes we have challenges of getting the medicines and other supplies that we need on time. If anything happens on the waters, if the ships are diverted, if the borders with Kenya or Tanzania are closed for one reason or the other, we have challenges as Uganda because we are not directly linked to the oceans. So having a bigger store secures the medicines for Ugandans better. We make sure that we have more amounts of stock. The way you can have more money in the Bank of Uganda as reserves. So we have that, what we call buffer stock at both Entebbe and Kajansi. And we are sure that if anything goes wrong on our borders or the ship or anywhere, Uganda will still be secure with sufficient medicines for a few months.
Okay, so if I was, say, a member of parliament or an RDC and I'm providing oversight, what tool do I need to prove that NMS has actually delivered? Is there any document that I can rely on to say, okay, I know there are concerns of people are saying there's no medicine, but how do I prove that NMS has actually delivered?
That delivery note is the first thing that you use. It's actually the most important document that you have with you. Because once these documents are signed, we leave the original copy of what we have delivered at the health facility. So anybody, that is a public document, anybody who is asking what was received from National Medical Stores can refer to that document. And remember that NMS also has an IT tool. We also developed another IT tool where we inform the people who are going to receive the medicines. We don't just appear at your doorstep. No. The moment the medicines are loaded and we are on our way to your health facility, you will receive a message, an SMS message, and also on your email. If you have provided us with your email address, you will receive a message telling you that NMS has dispatched a truck and it is coming to you. And we copy this message to the responsible people, the DHO within the district for all the health facilities that are within your district. We copy the same to the RDC of that district. We give that copy also to the, politicians, all the members of parliament of that district to receive the same message. So everybody knows. And once these medicines are received and they are cross-checked and everything is okay, we again send another message to the same people, telling them that the medicines that we sent were received in good ordered condition, and even give them the number of the person who received it, the telephone number of the person who received, and also the name of that person. People
call you, they call everybody and say, we don't have medicine, we are being told to go and pay for medicine. Is NMS responsible for that, for the stock out?
To the extent that the the wananchi know that NMS is the one that is given the money to buy these medicines, they are right to think that we are responsible. But the truth is that we are not responsible for that last stretch of the medicine going to the patient. The last stretch of NMS, which we call our last mile, is when the medicines are received by the in charge of the hospital.
That's where your mandate stops.
That is where we stop. That's where the law tells us stop. Once we have handed over this medicine to the health facility, now the responsibility is for the health facility to manage these medicines or to give these medicines to the patients who need them. Now, when therefore people talk about the stockouts and NMS, I think they need that information, that NMS will have done its work. We will have delivered these medicines. We deliver them during broad daylight. And the district, the local governments should have mechanisms of ensuring that whatever is delivered by national medical stores gets to the people who need it. So when the medicine is either stolen by whoever it is from the health facility, it is the health facility that did not secure these medicines. It is not NMS. NMS is not responsible for guarding these medicines. When these medicines are not given or prescribed to the patient, because we have also had situations, a few of them, but they say a lot about some of the wrong things that may be happening at the health facilities, that somebody has the medicines, but they don't prescribe it to the patients for reasons that we have never understood. There are a few cases, but even if it is that one person, it is bad enough. We have situations where...
So would that be like artificial shortage?
Yeah, that is the one that causes either artificial shortage, we call it artificial shortage, meaning I go to the health facility, I am a patient, you test me, you find that I have malaria, and instead of prescribing for me the Coartem, which you have, you prescribe for me another anti-malaria, which is not supposed to be in the health facility, another type. But that type is available outside, and that outside is in front, in the drug shop, in the pharmacy, in a clinic, which is in just in front of the gate of the facility. So that is unethical. People who are doing that should stop. And there should be a mechanism to detect that and stop them from doing that and punish them for doing that.
Especially where a patient is asked to go and buy medicines, and yet there's free medicines from the government. What should they do?
There are supposed to be helplines with the medicines unit. I don't have them with me here, but I believe that health monitoring unit under State House is responsible for that. They monitor some of those cases. So somebody is supposed to contact them and tell them that we are supposed to get these medicines and they are not here, and the health monitoring unit is supposed to intervene. It may not intervene immediately because they are few and the cases may be many. But what you are giving them is you are allowing them that at the earliest opportunity, they will want to come and check in. One, at the time when this person said that they did not get their Coartem, was this Coartem there? Well, did you order for it? That's number one. Number two, did you receive it? Number three, can you account for the doses that you received? So then they can go and respond in general terms. They may not be able to respond in specific terms to that patient, but in general terms, once people get to know, the people in the hospitals, the people in these health centers, once they get to know that there's somebody who is looking out for these things, they will also start behaving.
Okay, you are the custodians of government medicines, but we've had some times that this medicine is stolen. What is your role in ensuring that government medicines are not stolen?
The best that we could do is we keep the security of the medicines when they are in our hands. So we make sure that nothing gets out of our warehouse at national medical stores, either in Kajansi or Entebbe, in terms of being stolen. Nothing will happen. Number two, we also ensure that nothing gets stolen on the way from our warehouse up to the individual health facility. That one will not happen. But then number 3, we have also helped the wananchi, we have helped other government agencies to be able to easily identify the medicines that belong to government. All the medicines that belong to government, which go through national medical stores, are written on clearly, Government of Uganda, not for sale. We have put a UG on each of those packets. Up to, if it is a big tablet or a big capsule, there is a UG on that tablet or that capsule, which means that that medicine is not for sale. Now, again, the responsibility is on one end, because NMS does not do the policing work. But the people where these medicines are delivered, they know the people who take them out. They are the border people who help them carry these boxes out of the hospitals. They are taxi people who help them. They are these drivers. Let the people make as much money as possible if they get these medicines. If these medicines are taken to a clinic, if they are taken to a pharmacy, if they are taken to a drug shop, they can be identified. And we have had very many cases of people, the wananchi, who are engaged, who have actually been able to help police, to help the medicine.
So how do they report?
They just report to the nearest.
If I walk into a pharmacy and find...
You walk into a pharmacy, they give you the medicine, and you check that medicine. Yes, you may pay for it. You don't have to say, I am not going to pay for it, because probably you had gone with the money. The best thing you do is just get these medicines and go and report the nearest police station. They will give you a police officer who will accompany you to that pharmacy, and they will be able to recover those medicines. The challenge, again, that we have, in as far as that is concerned, is that the sentences are still very lenient. The law does not give people punitive sentences. They give up to 2 million shillings. So the person was found with medicines worth 500 million, and you're asking them to pay 2 million. They will just pick it from their pocket pay and they just get out. Yes, for us, we have secured a conviction, but there are also efforts by National Drug Authority, whose law that we are using, and the Minister of Health, to take this law to Parliament and revise the sentences and make them more punitive. What we would like to see is that the minimum that somebody should pay should be 3 times the market value of any medicine or medical supply that you afford.
As we conclude, what are the challenges that NMS faces today or over time, and how does that affect your operations?
NMS, like any government institution, has challenges. One is that we don't have all the resources that we need to do what we are supposed to do. We would need a much bigger budget, but we know that the budget comes from the taxes that we pay as Ugandans. So, and then we also need many other services. We don't only need medicines. So the available budget, the available cake is cut according to what is available. So it is a challenge because we have a responsibility, but we do not have all the resources that we need to respond to that. But then we have been advising people that is only one side, because 75% of all the diseases that we take to these health facilities, whether they are government or even the private, 75% of them are preventable.
Wow.
The challenge is we don't prevent them. When you go today to a government health facility and you find 100 patients suffering from malaria today in Mulago, you know that 75 of those patients,
of the 100,
should not be there if they had prevented that malaria. If they had made sure that they clear the bushes around their houses, if they had made sure that they remove the stagnant waters, if they had made sure that they sleep under the treated mosquito net, they should not be in Mulago now looking for malaria medicines. Only 25 should be there. So if National Medical Stores, with the limited budget, takes to Mulago Hospital 50 doses of antimalarials, and there are 75 patients, the 50 doses will not be enough. So the 25 will go crying that they are not medicines. But then remember that they are supposed to be only 25. So if all these people had made the effort to prevent, and only 25 appear there, the 50 doses which we take there will be more than enough. So if we prevent diseases, which we are supposed to prevent, it will help not only the health workers, it will also help us as the patients. We will not be falling sick. Because every time we fall sick, it is not just that I fall sick and I go and government gives me free medicine. Even if government had all the money to provide you all the medicines you need, still, by falling sick, you have not worked. By falling sick, somebody can fall sick and they even die.
That's why, they say prevention is better than...
That is why we say prevention is better than cure. It is cheaper, it is very effective, and it is the way to go. People need to know what they are responsible for and what government is responsible for. You do not go and you relax on doing what you are supposed to do and think that the health workers are the ones who are going to take care of your mess. No. It is like going around, littering the whole place, throwing around bottles and say, KCC will come and collect these bottles. We don't care. If you collect those bottles, you will have helped yourself, you have helped your environment, you will also have helped KCC. So if you prevent these diseases, you will have helped the health workers, but you have more than enough helped yourself. Because the money, even if government gives you the medicine, it will not give you the money for transport. It will not give you the money for feeding when you go to those health facilities and spend there 1 week or 2 weeks. You have not worked. By the time you get back, things have happened, bad things have happened to your home. So if you had prevented this malaria, you would prevent a death, you would prevent sickness, but you also keep the money in your pocket. So we keep urging people that actually if there is a message that can make Ugandans rich instantly, it is the issue of prevention. Because we know that a big proportion of the money that we earn, we spend it on healthcare for ourselves and the people and our relatives and friends. His Excellency, the President is talking about this model of PDE. How I wish PDE could also be incorporated, could also have a very big dose of preventive healthcare.
Okay, so you talked about lack of resources, which every MDA sings about. Are there avenues that NMS would utilize to mobilize resources, perhaps, to kind of support your operations?
We've said that we do not have all the money that we need to buy the medicines and provide better health care for the wananchi. But then we also know that the money government mobilizes from the wananchi, because the money is with wananchi. While it's been collecting the taxes and putting them in one basket and all of us share out of that basket, there can be a targeted mobilization of resources for improvement of healthcare. And one such avenue is through the National Health Insurance. This is something that we've talked about. Almost every other country, almost all the countries now that we have in the traditional East African cooperation, here in East African region, have health insurance. All of them, other than Uganda. It is very unfortunate.
Why doesn't Uganda have a national health insurance?
We have been going back and forth on it. I think the last issue that the wananchi presented to the president was that they will be paying more. And I think these were the employers, because the draft for the national health insurance then was asking them to pay more in addition to NSSF, in addition to all these, that they pay more. So we believe that we, the wananchi, should be the ones paying this money from our own salary, just a small proportion. And if we make that contribution, what it means is that whenever the wananchi are sick, they will not have to be queuing up only in the government health facilities. They will be able to receive treatment or healthcare from any nearest health facility that is accredited by the Ministry of Health. So you don't have to travel all the way from wherever you are to go to Malago to look for a government health facility. Go wherever you are, they treat you, and that national health insurance money will be the one to cover for you. That is something that everybody would love. It takes away the pressure from government health facilities, but it also ups the game for government health facilities. If they don't up their game, then they have no patient, then it will be clear that government is investing in institutions that are not helping the wananchi. And the money will be moved from those institutions to other institutions, the private sector or the other government health facilities that will be giving a better service. So it will up the game for the health workers that are a bit of laissez-faire, because in the government, we also have a tendency of being more relaxed than the people in the private sector. So it will tell us to work harder.
As we conclude, are you likely to see Uganda maybe in 5-10 years with a national health insurance? And do we know what stage that debate or discussion has reached?
We are very helpful. I think the Minister of Health would be better placed to tell us the exact stage where this is. But what we were informed of the last time we were in the health committee with the Minister of Health is that it has been refined now to respond to the queries that the employers have, and we believe that probably this bill will be passed before the end of next financial year. We are hopeful that, but within the next financial year, this national health insurance bill will be passed, and then we can mobilize these resources and make healthcare better for all Ugandans.
All right, thank you so much, General Manager, we call you GM, Mr. Moses Kamabare, for joining us on our inaugural NMS Health Talks podcast. And to our viewer, thank you so much for tuning in. Don't forget to like, share, and subscribe this podcast, because we'll be sending more of these your way. My name is Shilan Dushre. I'm being your host.